Hi guys, so I have been meaning to talk to you guys for a long time about occlusion, and you've been asking me to do this live, so here it is. When a patient attends your clinic and they have wear on their front teeth, or not a patient, if you have wear on your front teeth, so your front teeth are shortened, then there's a reason why teeth are short, and you need to be like a detective. As a dentist, you need to be like a detective, and you need to realize what that reason is. So the reason people may have shortened their front teeth may be because they bite fingernails, it could be because they bite pen ends, it could be they bite hair grips, they could be opening packets or bottles with their teeth. There could be a whole variety of different reasons about why the teeth may be broken at the front, and it's really important to work out what that reason is before you can fix the problem. Because if you don't fix the reason for the problem, then when you restore the teeth, so when you fix the breakages in front teeth, then they will just break again. Now, another really major reason why front teeth may be worn down is because of a grinding habit. So some people grind their teeth on the back, and some people have really unusual habits where they grind their teeth at the front, on their front teeth or off to the side, where they just kind of find like some weird position that they like to grind in. And so when that happens, you'll find that the patient has either they've just ground all their teeth flat, so their lower teeth are flattened off, their upper teeth are flattened off, and they're all ground and worn down to sort of the same level together, to a shortened level together. Or sometimes there could be just like one tooth that's just shortened in one spot on the top and bottom, where they have this habit where they just grind on that one spot. So you need to have a look at their mouth and work out what might be causing that. Have a look at how their lower teeth fit on their upper teeth. Your lower teeth should not fit on your upper teeth when you move forward. So say with me, for example, now, if I try and push my front teeth together, I just don't want to do it. The roots of those teeth are quite thin and long, and they're just not designed for the teeth to be able to put a lot of force on them at the front there. So it shouldn't be comfortable. If when you ask a patient to bite together, or if you are the patient, when you bite together, and you bite on your back teeth, it doesn't feel, you say to a patient, bite together, and they bite on their front teeth, not on their back teeth, then that's because they have a grinding or a clenching habit where they prefer to bite on their front teeth, and that's how their jaw is wired. So that's what I want to talk to you about in a little bit more detail. It's a bit of a complex topic, but you guys ask me about it all the time, so I'm going to try and explain it to you, and I'm going to save this to my page so that you guys can watch this again and again, and do ask me if you have any questions. So the way that the face is set up is you have this temporomandibular joint. So your TMJ joint is in this part of your face, and it fits together like a ball and socket joint. So if you imagine a skeleton, you have the side of your face, and then you have your mandible, and it opens and closes within that ball and socket joint. Now, if your face is set up exactly how it should be, so that ball and socket joint is set, then when your teeth come together, you're still in the ball and socket joint, and when you close, you're still staying within that ball and socket joint. However, for a lot of us, as we develop, and it could be because we've had braces, it could be because of the way our wisdom teeth came out, it could be just because of the way that our teeth developed, it could be because of work that you've had done, a crown that you've had placed. So for whatever reason, for some of us, when we bite together, so all our teeth are meeting, this ball and socket joint isn't lined up. So when we bite, this ball and socket is off on the side. Now, if when you bite together, you're not perfectly lined up, but you only bite together when you eat, so that's for like 12 minutes a day, then that's okay, because your mouth at rest should be with your teeth apart. At rest, your teeth shouldn't be touching. So if you're someone who doesn't grind or clench their teeth, and your teeth are apart at rest, then it doesn't particularly matter whether your jaw is perfectly aligned. Now, if you have a clenching or grinding habit, and like 85% of us in London do, and the reason for that is because living in London is stressful. So, normally crossing the road is stressful, getting on the tube is stressful, not so much in lockdown. Maybe even in lockdown actually it is, because you've got different concerns. Then we tense up our facial muscles, because by tensing our facial muscles, our masseter muscles, which are really big, strong muscles on the side of our face, it releases endorphins that make us feel better. So human beings tend to hold tension either in their stomach, and so then they may have stomach problems, IBS, other issues, or they hold their tension in their face, and then there's like a grinding, a clenching issue where we're holding that tension in our face. There's no real way to stop it. We can try and control it. We can control it with Botox, our masseters, to stop us from being able to clench. We can control it by wearing a night guard at night, so that when we do clench, our teeth are protected and we're not breaking our teeth against each other. So there's several different things that you can do to try and help the habit, but you can't really stop it. It's related to stress. So if you were to go away on a yoga retreat for 6 months, then you probably would stop clenching your teeth. But then when you would come back to England or to London or to whatever city, busy life that you have, you would probably start clenching again. So it's just something that we need to be aware of, and something that we need to manage. And if our ball and socket joint, our TMJ joint, is well lined up, then it's okay, and we manage it by clenching on our back teeth, wearing a night guard, maybe Botoxing our masseters. So lots of different ways that it can be managed, and your habit's not very visible to the rest of the world. So, I traditionally clench my teeth. It's not very visible. I clench on my back. You guys can't tell from the front, and that's okay. Where it's a problem cosmetically for us is when you start clenching on your front teeth, and then your teeth get shortened and it looks unattractive. And then it's a problem for the patient because they've got these shortened front teeth, and then it's a problem for the dentist because we want to restore this for them, but there's nothing that we can restore with ideally that wouldn't be as strong as your own tooth. So if you've broken or eaten away your own tooth, you're going to break or eat away our restoration. So what we need to do is look at your jaw joint. We need to look at how we realign your jaw joint so that when you bite together, the jaw joint is in the correct position. Because when you bite together and your jaw joint is not in the correct position, then your condyle is not sitting on this nice padded area that it's designed to sit on. Instead, it's sitting on bone. So if every time you're clenching, and if you're clenching your tooth or grinding your teeth for 8 hours a night, you're grinding or clenching on hard bone. So of course that's going to be uncomfortable. And that's why sometimes people develop so that when they open and close their jaw, they get a click on opening and closing. And that's because they've worn away a notch onto their hard bone from where they're clenching, where their jaw isn't perfectly lined up. And not only that, if you're clenching in an area where your jaw isn't perfectly lined up, that's really uncomfortable, clenching on that bone. So instead you take your lower teeth and you pull them out of occlusion to the front here, and you start doing weird things, grinding on your front teeth, and you start breaking them, and it doesn't look good. And if a dentist tries to fix it for you, you break it again, so it's even really hard to restore. And all your ligaments in your face and in your neck and your upper back are all pulled out of alignment because the joint is no longer in the correct position. So your ligaments are pulled out of alignment, everything's pulled out of alignment, you end up getting back tension and feeling all the time it's not quite right around here. Your front teeth look worn, and people can see that you're stressed because you've got this worn down smile, and so there's all this stuff going on. So to restore a patient back to correct their jaw position for them, there's a treatment that dentists can do who have studied occlusion. And I studied occlusion at the Dawson Academy in Florida back in the day, over 3 years, 2004 to 2007. I think I was back and forth learning there. And so what you need to do is you need to give your patient a deprogramming night guard. So you say to your patient, I'm going to deprogram you. Or as a patient, you say, I need to be deprogrammed. You find a dentist that can do that for you. And what they do, what the dentist will do, is give you a night guard that's kind of chunky, and it sits on your front teeth, and it stops your back teeth from meeting. Now, because the back teeth can't meet anymore, at night time, when you go to clench, and you look for that awkward clenching position that you like to clench in, you can't, because you can't get your back teeth together. So eventually, your muscles and ligaments get tired of trying to clench, and everything kind of fatigues and relaxes, and finally, your condyle will reseat to its correct position. So you're back to where you should be. All your ligaments will realign, everything will reset, and you'll wake up in the morning, and you'll be like, oh, yeah, that's where everything should be. I didn't even realize that I was in constant discomfort until you put my everything back to where it should be. But then you will take your night guard out, and you will clench again during the day, and you will clench back into that bad habit that you've made, and then it's a cycle and it continues. So what you need to do is get one of these deprogramming devices. You need to wear it to sleep at night, get it made by your dentist, wear it to sleep every night for at least 2 weeks, let your muscles relax, and then you come in and see your dentist, and then your dentist can reposition your jaw for you. So there's a way that we do that by putting a little bit of pressure on the jaw, and then have a look at how your teeth should fit together, mark on the teeth the bits that are in the way, that are stopping the teeth from fitting when the jaw fits, and then reshape your teeth a little bit so that now the teeth fit together when the jaw's in its correct position. So now when you go to clench, you're still grinding, but you're grinding in the right position. You're not breaking your front teeth anymore. Your ligaments and back and everything's back to where it should be, and your dentist can now restore your teeth, your front teeth, back to the length and the shape that they should be for your beautiful smile. So there you go, guys. That was a really long explanation, but I hope some of you find it useful. Feel free to message me about it, and definitely go on a more advanced occlusal course as a dentist to learn more about it. But it's a bit of an overview, something that I often explain to my patients when they've got broken front teeth. It's something that dentists always ask me about. So I thought if I put it here on my Instagram, there's something that you can all refer to whenever you want a quick revision of that. Have a good day, guys.